Institute for Animal Agriculture's Antibiotics Council. Thanks for joining us. So our mission at the National Institute for Animal Agriculture is to convene animal agriculture experts and allies in collaborative settings to explore, discuss, learn, and develop knowledge that fosters interdisciplinary cooperation for the improvement and continuous progress of animal agriculture. And that's really why we're here today. Before I get to introductions, I do want to talk about a few housekeeping items. And first of all, please mute your lines. If you haven't done that already, please mute those lines. Second of all, so we know who's with us today, if you would update your name on the Zoom screen. There are directions in the chat room in how to do that. So just click on the chat button below. There are instructions by clicking the three dots. You can update your name so we know who's who. That would be very helpful to us. We will reserve questions till the very end. So once all speakers have given their presentations, we definitely want your questions. So we will hold those though until the very end. But feel free in the chat room at any time during the presentation, feel free to type your question. If something comes to you, you don't want to forget, just type that in there at any time, but we'll hold those questions to the very end. Just a couple other reminders. We do have a couple upcoming NIAA events. You'll be reminded of these at the end as well. We do have an NIAA annual meeting coming up, and our theme this year is exploring sustainability in animal agriculture. We know sustainability is a huge thing, and we all need to be talking about that and all working together on sustainability. That is April 21st through the 23rd. So mark your calendars, April 21st through the 23rd. It will be virtual this year, so hoping that many of you can join us for that. We also will be having our 11th annual NIAA Antibiotics Symposium. It'll be held in Kansas City this year. It will be November 2nd through 4th. We certainly are hoping to be in person, but I think we'll know more as the time gets closer. Also a reminder, we're always looking for members. If you are not currently a member of NIAA, we'd love to have you. And you can join us online at www.animalagriculture.org. So www.animalagriculture.org. So I should introduce myself. I'm Dr. Leah Dorman. I'm Director of Communications and Consumer Engagement for Phibro Animal Health. I serve as co-chair of the Antibiotics Council for NIAA. I'd like to introduce the co-chair and my partner in crime, as I often call him, Dr. Eric Moore. Dr. Eric Moore is the Director of Technical Services for North America for Norbrook. So our Antibiotics Council, so NIAA Antibiotic Council, the goal is to seek to enhance an animal agriculture industry that is aligned with judicious antibiotic use policies and practices. And that's really why we're here today, is to talk about the antimicrobial use data collection in animal agriculture. So enough from me. I have the privilege today to introduce our panel of experts. So I want to introduce all of our panelists today. The first being Dr. Susan Bright. She's a graduate of the University of Missouri and University of Maryland. She currently serves as Veterinary Medical Officer in the Office of Surveillance and Compliance for the Food and Drug Administration. Our next panelist will be Dr. Randall Singer. Dr. Singer is a graduate of the University of California, San Diego, as well as the University of California, Davis, and he is a professor at the University of Minnesota in the Department of Veterinary and Biomedical Sciences. Our third panelist is Dr. Peter Davies. He received his education from the University of Melbourne and also the University of Sydney. He is a professor at the College of Veterinary Medicine at the University of Minnesota. And our last, but of course not least, panelist is Dr. Mike Appley. Dr. Mike Appley is a second-generation veterinarian from Larned, Kansas, and he studied at Kansas State University. and he is on faculty at Kansas State University College of Veterinary Medicine. So thank you so much to all of our panelists and for everyone who has joined us today. And with that, I will turn it over to Dr. Bright to kick us off.
Well, thank you very much, Leah, and also just thank you all very much for just giving us the opportunity to come and talk a little bit about our activities at FDA with regard to antimicrobial use data collection in animal agriculture, and also just want to thank everyone for attending today. So today, I'm just going to very briefly review some of the changes in policy related to antimicrobial use that were brought about by FDA through our guidance for industry 209 and 213. Most of you are probably familiar with. Also wanted to just describe some considerations for how we might assess kind of the impact of some of those changes. But primarily, I wanted to be able to introduce the great work that has been going on in the field of antimicrobial use data collection conducted under our cooperative agreements with your guest speakers today. As most of you are probably aware, as I mentioned, in 2013, FDA published Guidance for Industry 209, and it essentially laid out our plans for eliminating the use of medically important antimicrobials administered in the feed and water of food-producing animals for uses in growth production, growth promotion, and also, also included a provision to change the marketing status to include veterinary oversight for those types of products. So again, production purposes, as I mentioned, those are related to growth promotion claims and increased feed efficiency. And then in terms of the marketing status, that essentially resulted in the medically important antimicrobials administered in feed or water for the feed products changing from an over-the-counter marketing status to a veterinary feed directive status, and for the water administered products being changed from over-the-counter to prescription status. And now as part of that process, since many of the products were administered in feed, we also needed to update some of the existing veterinary feed directive regulations that had been in place for years. And again, the VFD is essentially kind of the legal framework for the provision of veterinary oversight over medicated feeds. And so after some changes were made, the veterinary feed directive final rule was in effect as of 2015 in October. And then importantly, by January 1st of 2017, all of the work mentioned in that first bullet was fully implemented so that all feed and water uses of medically important antimicrobials in food producing animals now do require veterinary oversight and are no longer approved for production purposes. And just to give you a quick idea of how many products were affected, initially, there were 292 products that were affected by these guidances. 84 of them were completely withdrawn. 208 of the 208 remaining ones, 93 were water products. So 93 products converted from over-the-counter to prescription. And there were 115 feed products, which were converted from over-the-counter to veterinary feed directive status. And let's see, I think production indications were withdrawn from about 31 of the applications, just to give you an idea of some of the numbers. So as those changes were brought about, we also clearly need to try to determine the impact of the changes. So we were concerned about, how can we measure the impacts of those on animal health, on antimicrobial use practices, on antimicrobial resistance, and as well as public health. And so obviously tracking progress is essential. And to be able to track progress, data are certainly needed to help kind of try to adequately assess the impacts. So let's see. Oops, sorry, skip that. The other thing I just wanted to briefly mention was that in 2018, most of you have probably also seen our 5-year AMR plan. Basically, a lot of the activities that we have going on right now are kind of described in this plan, and they're kind of grouped under these 3 main goals. I won't read them out, but what we're focused on today is basically that 3rd goal, to enhance monitoring of not only antimicrobial resistance, but what we're talking about today is antimicrobial drug use in animals. Also just kind of wanted to say that our kind of overarching goal at CVM is to support antimicrobial stewardship in veterinary settings by implementing measures that, you know, will help address the kind of public and animal health concerns related to antimicrobial resistance, while at the same time assuring that our animal health needs are being met. So I just wanted to kind of start out just with this one slide on sales. You know, so speaking of data, currently we do regularly report on antimicrobial sales data, as well as some antimicrobial resistance data through the NARMS and VetLearn and other government programs. But this particular slide is just showing an example of some of the data from our 2019 annual sales report. And, you know, really, let me go on ahead. This is pretty much, you know, the extent of the data that we have for sales. Excuse me, I just need to go back one slide. I don't know if it will let me go back. Yeah, so this is basically showing you know, an example, like I said, by drug class and by species from our antimicrobial sales report. But, you know, really, this type of data has quite a bit of limitations in terms of, you know, this is not really just looking at quantities sold is not really providing us with information about how the drugs are used. Which is really what we're looking for when we're trying to look at stewardship and show that stewardship is happening. And again, these are just, you know, flat totals, you know, and it doesn't really provide any information beyond that. Now it is, you know, certainly valuable in some respects in terms of looking at kind of broad shifts in the marketplace of just changes from year to year. But we do know that it's not really detailed enough for what we need to be able to interpret some of the other things. So why would we want to collect antimicrobial use data? As I just mentioned, the limitations of sales data. Sales do not necessarily represent actual use on the farm. So by collecting on-farm use data, it will help us evaluate those actual conditions of antimicrobial use. And in that way, kind of hopefully help us demonstrate progress in antimicrobial stewardship on farms. In addition, it also can provide us with an opportunity to evaluate the relationships between use and resistance, as well as the opportunity to be able to evaluate how our antimicrobial use practices are resulting in certain health outcomes. So at the same time, though, while it is very important to consider why we want to get some antimicrobial use data, we also do have to recognize some of the challenges, certainly. So this type of data is can be fairly resource intensive to collect. For a number of reasons. One being, you know, there's a wide diversity of production settings, both even between species groups and even within species groups. There are quite a few differences in the level of detail of farm level records of antimicrobial use and other animal health outcomes. And we really don't have a real uniform system that captures this type of data currently. The other thing that could be of concern certainly would be the misuse of antimicrobial sales and or use data. And what I mean by that is, you know, if we're not able to provide the proper context to interpret the data. So that context could include, you know, animal health data, what diseases are particularly challenging in any given year. You know, so that type of contextual data is important to be able to interpret this. Also, another big concern certainly is to be able to protect the confidentiality of those who participate in providing data. And then also just kind of how to report on progress. So I have this last point on here about agreeing on metrics. And what I mean by that is just kind of how should we report on our progress? And sometimes it might be beneficial to choose one metric, you know, so that it's relatively simple and easy to understand. In other cases, it might be more beneficial to really provide several different ways to look at the data. So given the fact that FDA and others recognize the need to collect this type of data, in 2016, we did issue a funding opportunity announcement. And we essentially just requested proposals that would provide the type of data that I have laid out here on the slide. I did just want to highlight one of the main things was that we wanted, because part of the impetus to design these agreements was that we wanted to kind of measure the impact of some of the changes that were brought about by GFI 213. One of the things that we did want was to be sure that we were able to get data to look at before. So we kind of wanted to go back to 2016 at least, and then forward. And another very important part of this was just to really pilot methodologies, provide inputs and opinions on how to collect, summarize, and report the data that was collected, and certainly minimize the burden to all of the producers who were able to participate, which we are very appreciative of. So 2 grants were awarded in September of 2016, and these are the topic of today's talk. So I was just hoping to try to provide a little bit of background. So hopefully I was able to do that leading up to their talks. And, you know, in summary, I guess just wanted to say that, you know, we really are aware that, you know, data from multiple sources are needed to kind of provide that comprehensive approach to an evaluation of the situation in animal agriculture with use and resistance. We certainly believe that the data will support, you know, the continued availability of safe and effective antimicrobials for use in treating animals and people. And, you know, again, these particular projects are going to be ending later this year, and we are planning to kind of take some of the information learned through these projects, and as we're considering our next steps to for where we're going to go from here. And that is all I had. Thank you.
Great. Well, thank you, Dr. Bright. I guess I'm next in line since I see my slide. What I'm going to do today is give you a really brief overview of the poultry aspect of this project. So some of the data that we collected from broilers and turkeys. And again, this is going to be a very brief overview. I think the other species, I've presented on this many times, some of you have probably heard it, but I think there are complexities in the swine and cattle projects that need a little more time. So I'm going to hopefully give them sufficient time to present their material. So to start, as Dr. Bright already mentioned, one of the primary objectives of just getting started with this was to develop and demonstrate the approach for collecting on-farm data. Now, for the poultry project, we had a little bit of, I guess, a head start on the other species through a pilot project funded by the U.S. Poultry and Egg Association, we actually were piloting some of this back in 2014, but it actually even was earlier than that. So we were already working within the industry to figure out how best to collect these on-farm data from broiler and turkey. On top of that, because of the vertical integration of these industries, you can get a massive amount of data by enrolling a few number of companies. It's not as extensive as, for instance, beef or dairy production. So we had some advantages and also a head start to get these data collected. The actual work that you're going to see me present that's also in the articles in that special issue, this now represents basically a public-private partnership between U.S. Poultry and Egg Association, the poultry industry, and then and FDA, with funding coming from both U.S. Poultry and Egg Association and FDA to help support this. It's important to recognize that everything you're going to see, including the amount of participation we got, was entirely voluntary. And there is nothing being required at this point. And so all of the companies that participated did so voluntarily. We did guarantee their anonymity in participating, as well as confidentiality of the data. And that's one of the things we had been piloting back in, let's say, 2014 to 16 before the RFA was put out by FDA. We were only going to present the data in an aggregated form. So what you're going to see are the industry, so entire broiler industry data, the entire turkey industry data. It's not broken out by company. And this initial publication covered the data collected from 2013 to 2017. As Dr. Bright said, they wanted to be able to assess were there any changes pre and post the full implementation of guidance for industry document 213. But because the poultry industry had already been shifting considerably how they were using antimicrobials prior to that January 1st, 17 date, we felt we needed to go back further to really see that trend. And so the data that I'll be presenting look at 2013 to 2017. I will say that we are also continuing our data collection currently, and the data that we're now collecting will cover 2017 to 2020. The reason we're repeating 2017 is now we're getting much more granularity in the data we're collecting down to flock level treatment records. What I'm going to present to you, this first effort, was really just almost an accounting project of how were antimicrobials used in total within the broiler and turkey industries. So let's first start with the participation. What you're looking at here are the numbers of approximate percentage or of participation of the industry for both broiler and turkey. And again, the data covered 2013 to 17, and so participation wasn't a constant. Not everyone could go back and get the 2013 data, but by the time we got into the 2017 data set for broilers, that covered almost 90% of annual production in the United States. So for 2017, that our data represented more than 7.5 billion chickens slaughtered and 48 billion pounds of live weight. On the turkey side, it was approximately 70% of annual production in the United States for the 2017 data set, and that covers more than 164 million turkeys slaughtered and 5 billion pounds live weight. So this, for me, was one of the successes for us in this first phase of the project, getting such an incredible level of participation from the broiler and turkey industries, where we really are capturing the far majority of the annual production and therefore of how the antimicrobials are actually being used on farm. And again, I've highlighted here that special issue, which I think the URL was put into the chat. All of these articles in that special issue are free to download. I'll just quickly go through a few of the key results, and the way that I organized the poultry articles were really by route of administration. So we have first the hatchery antimicrobials. These are injectable. They are either done in ovo or into the day-old bird In broilers, they tend to be in ovo injections. And on the turkey side, they are usually done as day-old poults. So it's one of the rare injectable administrations that you'll see in the broiler and turkey industries. And the primary drug that would be used is going to be gentamicin. There was some ceftiofur use as well. So let me orient you to what you're seeing here on this graphic. What you see here on the x-axis is going to be the year. So on the left side is broiler and on the right side is turkey. The y-axis represents the percentage of the birds that are placed. So hatched, then they go out to the farm and they're placed. The percentage that would have received an antimicrobial. If it's blue, it means they received gentamicin. If it's green, it's penicillin. And if it's this, I guess, salmon sort of color, that's ceftiofur. If it's gray, it means they received no antimicrobial associated with the hatchery. So what you can see on the broiler side is that about 7% of the broiler chicks placed in 2013 received no antimicrobial, and that increased to approximately 83% received no antimicrobial in the hatchery in 2017. So that is a pretty substantial decline in the administration of an antimicrobial at the hatchery. On the turkey side, what you see is about 4% of turkey poults received no antimicrobial in 2013. That increased to approximately 59% received no antimicrobial in 2017. Again, a pretty substantial decrease. This is a really important piece that if you're not familiar with the poultry production system, this is not easy to do. Pulling the antimicrobial out of the hatchery, this is often considered a prevention administration for some of the E. coli diseases that can severely impact chick morbidity and mortality in that first week of life. That first week of life is what sets up their health status for really the remainder of the flock. And so if you're going to pull an antimicrobial out of the hatchery, it takes a lot of work, both in the hatchery during the brooding phase, to ensure that you're not going to have severe morbidity and mortality issues. So these kinds of changes, this takes a lot of work by the companies to be able to make this shift. And so again, I would commend the companies that were able to do this. I'm glad that we still have the ability to use antimicrobials in this way, because there may be times when you need a prevention dose when you're having problems with chick and poult placements, morbidity, mortality. But again, that is a pretty substantial change in use and required a pretty substantial investment in the hatchery and in brooding. I'll jump to some of the feed data. Again, I'm not going to go through, the manuscripts have a lot more information. I just wanted to highlight a key take-home message that comes from the in-feed data. What you're seeing here are just some examples of the broiler in-feed data. On the top left is tetracycline use. Top right is virginiamycin use, so a streptogrammin, and on the bottom is bacitracin use. What you're seeing in the columns, these green columns, represent the amount in kilograms per year. So 2013 to 17, and the line represents in these graphs grams of drug per million pounds live weight. In the manuscript, we actually changed this to being milligrams of drug per kilogram live weight. But for those of us in the US, we often think about pounds live weight, and so I decided to keep this slide in for this talk. What you can see over time, this also translated to the turkey side as well, are some pretty substantial declines in the medically important antimicrobials that were used in feed. Now, as we already heard, with the full implementation of GFI 213, these would not be allowed, if there even were labeled, that they would no longer be approved for use as growth promoters because of the disappearance of any labels for that, for the medically important drugs. But even still, you can see the declines were happening well before the full implementation of 213. And this is, again, why we wanted to go back to the 2013 data and cover it through 2017. So what we see consistently are very substantial decreases in the amount of antimicrobial being used in the feed for the medically important drugs, but a fairly consistent level for the not medically important compounds like bacitracin. In fact, it does seem for both broiler and turkey that for the in-feed antimicrobials, there was a shift moving from the medically important to the not medically important, which could be viewed as an aspect of stewardship if your goal is to preserve the efficacy of the medically important compounds. Okay, so that again is a message that you would see in both the broiler and the turkey data. The other thing to recognize, if you're not that familiar with poultry production, is that these in-feed uses would really represent the disease prevention administrations. If you're needing to treat and control illness in the flock, you'll tend to do it more often through the water instead of through feed, because the sick birds will tend to keep drinking, they may not eat. And so you can deliver the antimicrobial quicker and reach the birds faster than with an in-water administration. So I'm not going to go through all of the water data. I just wanted to highlight one, again, a key point that I make in the manuscripts for both broiler and turkey. This actually is the turkey penicillin use in the water. This is the version of the figure that appears in the manuscript. You can see here for the line, it represents milligrams per kilogram live weight. The other y-axis is just total kilograms in the bar, or these columns. And what you can see with penicillin, again, this is the water administration of penicillin, is still a pretty substantial decline over 2015 to 2017. In fact, the decline between 2016 and 17 was approximately a 26% decrease on that milligrams per kilogram live weight basis. That's a pretty substantial decrease. Why is penicillin being used in this case? This is to treat and control disease in the sick turkey flocks. The most common diseases for which you would use penicillin are going to be the clostridial diseases, primarily gangrenous dermatitis. This is not a disease for which we can easily control. It's Clostridia. There are many factors that predispose a flock to it. We don't have great efficacious interventions other than the antimicrobial treatment for the sick flocks. So penicillin remains a really important antimicrobial for treating disease. And the problem here, if your goal is reduction of antimicrobial use on a let's say a milligram of drug basis, this drug penicillin has a very high molecular weight, is not very potent, and so you're going to use a lot of drug in milligrams. If you're playing a game of, I need to reduce my use based on total milligrams, it will be hard to do in, let's say, turkey because of the amount of penicillin that is used. So we can ask this question: how much can we actually reduce usage if that is your goal, just to reduce the total amount used? Well, there's a limit. You can reduce the incidence of disease, okay, and as I said, that's tough to do for diseases like gangrenous dermatitis in turkeys because clostridial diseases don't have efficacious interventions. We just have a lack of them. You could forego therapy for flocks that are experiencing illness. Well, that's just unethical. Well, how else are you going to switch? You could switch to a drug that's more potent. So I said, here's penicillin. It's a high molecular weight, low potency antimicrobial. Another drug that you could use would be lincomycin. If you were to look at the defined daily dose, let's say, of a lincomycin versus a penicillin, you could reduce your total grams of drug use more than 14-fold if you switched to penicillin to linco, only because of this difference in molecular weight or potency. And that, to me, is not necessarily good stewardship. We shouldn't be picking the drug with the sole goal of reducing our milligrams of drug use. We should be picking the drug based on what's going to be most efficacious for that flock's disease issue. So I want to warn us that playing the game of reduction based on grams of drug shouldn't really be our primary goal. So to conclude, so that we can move on to the other two speakers, what we did see in our poultry data set were just over that time span of 2013 to 17, really noticeable improvements in how they were managing their data with respect to antimicrobial use. You know, every company had a different way of recording their data, and yet regardless of what they had been doing, we saw steady improvements, and that improvement in data management is also a key component of stewardship. I know that based on the data I'm collecting so far on the 2017 to 2020 period, again, this progression in disease in data management has continued. I want to say once again that reduced use as a total amount of drug in grams shouldn't be your primary goal. Reduction is a part of stewardship, but remember that there are going to be years where disease incidence could go up. If disease incidence goes up, your use of an antimicrobial will likely also go up. And that doesn't mean you're doing a bad job on stewardship. It means you're perhaps doing a responsible job as a veterinarian managing the health and disease of your flocks. What should be our primary goal is reducing the need for the antimicrobials in the first place. And that, unfortunately, can be a really tricky thing to do because we have imperfect interventions for many of the diseases that we face. For instance, the clostridial diseases in poultry, which affect both broilers and turkeys. With that, I will acknowledge some of the collaborators on this project, but I want to emphasize again that this really was a public-private partnership between, you've got U.S. Poultry and Egg Association and FDA, both providing funding. You've got the participation of the companies, National Chicken Council and National Turkey Federation as well. And we worked with USDA APHIS in almost an auditing role. They reviewed aspects of the data from start to finish to ensure that what we were publishing was accurate and we could be as transparent as possible. That's all I have for you today. I'm happy to answer questions when we get to that.
Just a reminder to everyone, you can enter questions in the chat feature as we go along.
Good. Always hard coming after Randy because he does such a good job, but I want to thank first the organizers for the opportunity to be here, and also the whole group with the dairy and beef and poultry projects who've taught me a lot about those industries and over the last several years. So it's been a very educational experience for me. It started off, actually, I did a sabbatical with National Pork Board and NPPC, really to push forward the conversation about antibiotic use measurement and antimicrobial stewardship in the swine industry, and that was in about 2015. I'm not that old, 2015, 2016, and the FDA came out at the time I was still doing that sabbatical. So I sort of graduated into working on this, already collaborating with the national industry because they recognize the need as an industry to move forward and get better information for our industry to address the issues surrounding antimicrobial resistance a little bit more proactively. I just hopefully can advance here. Oops. Yeah, as Susan and Randy have mentioned, what I'm going to be talking about is data that's been reported in the special edition in Zoonosis and Public Health. For time reasons, again, I'll just really address several issues and questions that came up. I think there's a lot more to talk about in the methodology and the interpretation and the communication of these sorts of information rather than looking at the charts and the numbers, but I'll touch on just some of the broader aspects of it. In terms of the impacts that we saw coming out of the study, first of all, it was a feasibility study. Can we do this? Can we get the industry to voluntarily share proprietary and very politically sensitive data through their own goodwill? I used to say, I don't have a carrot, I don't have a stick. I just ask you, are you able to share data and willing to share data? And obviously, the issues related to confidentiality were substantial, and we had to talk through how we would address that. Again, had a good lead from what was going on in the other species, and were able to move forward. Secondarily, this was probably the first substantial description of antimicrobial use other than the FDA sales data. Certainly there's been other surveys, particularly notably by the USDA NAMs, that have collected information about antimicrobial use, but it's usually been survey-based and opinion-based rather than collecting data from the industry itself and describing that data. The third bullet point I've got here is really a discussion point, but I think it underlines a lot of the broader conversation about antimicrobial use and what is the right measure and how should we use those measures. And in the paper, we argue that specific metrics on antibiotic use that focus on individual industries and their individual realities will be more valuable to advancing stewardship than trying to find a compromise magic measure that we can apply to compare very different systems. So in terms of what might be the appropriate measure for the poultry industry, even the dairy versus the beef industry, the swine industry, they're very different biological systems, and also comparing the same species in different geographical regions. Pig production is not uniform. Animals are grown to different end weights. There's a lot of differences. So rather than trying to look for comparisons, what can serve us best is let's get the best data we can for the specific industry and the specific realities of that industry and constraints of that industry, and use that as an educational tool to advance stewardship, rather than trying to make comparisons that really don't have any sound biological basis. So I think that's, again, an important part of the conversation here. I've just got this slide in here, a little bit, that's something that Susan referred to in terms of use and misuse of data. So what we're describing here is a measurement exercise, attempting to understand the quantity of antimicrobial that's being used in the industry. And see, we have the reporter talking to scientists saying, what did the experiment find? Either we had a slight measuring error or physics are wrong. And of course, that what gets turned into is experiment might overturn Einstein. All of physics is wrong, says scientists. So I think a lot of the discussion here is understanding the constraints of your data, what it may or may not represent. And certainly in the publication, we go into quite a bit of detail in describing the limitations of our data, simply to try and guard against people taking things out of context. And as Susan says, providing appropriate context is a really important part of generating data on antimicrobial use. Just to describe, the pig industry, most of the people on this call are very informed. A lot of other audiences less so, but it's a concentrated industry, but it's a lot less concentrated than the poultry industries, a lot more concentrated than the bovine industries. And by concentrating, I'm meaning in ownership. We approached 17 systems. 11 of them were willing to share. In the end, we got data from 9 systems that produced over 20 million market pigs annually, which is about it was about 20% of the national production. As mentioned, the data were provided voluntarily because the participants took the view that to try and advance this issue in the swine industry, we needed to get a handle on the data, and they were willing to step up and provide their data, provided they were confident about the confidentiality. In getting this data, a lot of it is it's the art of the possible, particularly seeing in the swine industry, we're working retrospectively completely. We didn't have the initiative that Randy had starting a couple of years before. So to get 2016 data starting late in 2016, well, we're obviously looking at getting who had retrospective data that we were able to get together. And most of the data, apart from one farm, which was based on actual administration, were based on accounting data of shipments of products to farms, because that's what these businesses record and follow from a point of view of cost accounting purposes. It's not records of actual administration, but at the same time, versus for instance, differences to the sales data, we know that these antimicrobials were shipped only to pig farms, only in pig industry businesses, and so we are a lot more confident in terms of the species of use as such, obviously. But again, just remembering the nature of the data is very important to understanding its limitations. Just big picture results, no surprise here. Tetracyclines were the dominant class, around 60% of use. Again, by weight, we have use by weight the same way that Randy did. I think an important part of the report is that the critically important medical classes, based on the 2003 FDA classification, were around 5% of total use in both of the years. And I think equally notable, the two classes which have generated the greatest concerns, meaning the fluoroquinolones and third-generation cephalosporins, collectively represented 1%, less than 1% of total use, again, by weight. These are more potent compounds, and Randy mentioned earlier about that relationship between the size of the molecule and the dose that you use is really important. But on a weight basis, they constituted only a very, very small proportion of use. I guess, unsurprisingly, administration was predominantly oral feed or water. About 70% of use was in feed, 20 to 30% in water, and only about 2% by injection, again, on a weight basis. But for the critically important antimicrobial classes, about 12% of use was by injection, and a lot of that is driven by labeling availability. Some of those products can only be administered by injection. Another thing, we looked at the distribution of use across different systems and across years, and I'll just share one of the, well, first of all, just the breakdown, and I won't spend time on this. Here we have the breakdown of relative use, and so this is sort of like the pie chart. What proportion of use by weight was distributed amongst these antimicrobial classes, and you can see the tetracyclines there. The key point here is about the first 6 or 7 of these antimicrobial classes, which are all actually mostly relatively old products, constitute for about 90% of our use. So tetracyclines, lincosamides, beta-lactams, not including cephalosporins, polypeptide plurimutilins, macrolides, aminoglycosides, they account for well over 90% of use. This is the graph that here we're showing the individual systems, and this is again relative, not absolute use. So it's the color coding here is just showing us the distribution of classes in 2016 and 2017 between the different systems. So the first thing we note is there's a lot of light blue there. It'll be too hard to read. That's the tetracyclines, and you can see they're widely used, but there's substantial variability between systems. If we just look within a year, reading horizontally there, you can see that the distribution of classes is substantially different among different systems, and this is probably even more than I was expecting. If we look then comparing 2016, 2017, you can see there are some systems where use is very, very similar, and others where it's very substantially different. If you look at the first system there, you can see that there's been a substantial shift in the use of classes within that system, and that was because that particular system had a very privileged health status due to its location, and were phasing out the in-feed use of particularly tetracyclines and plurimutilin, and we're looking at removing in-feed use in 2016 to 2017. Similarly, if we look at the third one, System C there, we see there's a large expansion of macrolide use in 2017, and that was driven by a specific disease control program for Mycoplasma high pneumonia. So when we talking with the veterinarians, which is not in the data, and say when we look at these differences between years, what can we see to explain this? And these were situations where the shifts that we were seeing were in response to the veterinarians making steps to specifically address health problems or change their approach to antimicrobial use. So again, evidence that that these decisions are being made with intent and with purpose in relation to the animal health status that the veterinarians are confronting. Again, this is just one more chart that I've chosen, and we don't have time to go through all of these things. This is looking at use on a quantitative basis. So here our numerator is the milligrams of active ingredient and the denominator is kilograms of live weight marketed, and we can have a conversation about which denominators might be appropriate. But here, at least internally, we're able to look at the use in systems. Here they're ranked in these graphs by the use in 2016. So for all the drugs actually have different scales. So this is really just an illustration to show you the types of data we had. I won't get into it any further, except to look at the bottom left there. We can see this is Tylosin usage, and we can see we have an outlier in 2016 where we have one system which was using much, much higher levels of Tylosin than all the other systems, and that changed in 2017. And again, this is an illustration where this was a farm that was using Tylosin as part of a Lawsonia or ileitis control program, and then switched because there is a vaccine available for ileitis, or vaccines available for ileitis, and they shifted to a vaccine program away from using the antimicrobials. So again, getting real meaning out of these data, it's very important to understand the context, the circumstances, and why some of the changes are occurring that we're seeing. But again, demonstrating that changes in practice in relation to intent in managing animal health. Some of the things we don't have that we would like to have, indications for use. That's not something that's being captured in accounting records. The actual age and weight of use, unlike broilers that only live a few weeks, all use is relatively close to market age. In the pig, we've got a 6-month period roughly in the growing pig where antimicrobials can be used. And obviously the pig's going from 3 pound to 300 pound in that area. So interpreting the amount of drug that's used on a weight basis is incomplete if you're not understanding age and weight of administration. Also, details of administration, dose, and duration. We did obtain some of that information by survey from the participating veterinarians. And just to let you know, this was a 142 questionnaire that I sent to the veterinarians, and 7 out of 9 of them were kind enough to complete it for me because they're very, very busy people. But that at least gave us some baseline information on these things such as the indication for the use predominantly. But these were based on the professional opinions of the veterinarians, not derived from the data. One of the questions that we had was across these different antimicrobials, when is most of your use happening? And I'll talk you through there. So on the left, we have a list of medically important, non-medically important antibiotics. And the questionnaire, I was asking them about predominantly are these drugs being used in early nursery, late nursery, early finishing, late finishing, and then condensed into those columns of all nursery, all finishing. For 11 of the 19 products, use was predominantly, meaning more than 75% in this case, in the nursery. So this is consistent with data pretty much all over the world, and that the early wean pig is the vulnerable population in pig production. Obviously, you can have outbreaks in much older pigs, but as a difficult area, it's that transition of the wean pig that is problematic, and that continues to be the place in all industries. And we can see quite a lot of the drugs were only used in the nursery. If we get down in the non-medically important group there and look at the bottom right-hand corner, you can see there Carbadox, which has an extended withholding period, is only used in the nursery populations, where the other drugs that are not medically important are used much more in the finishing population. So I think in terms of understanding the implications of use, one of the questions that I have that we're trying to look into in a study is how much does it matter if, in terms of resistance, if animals are receiving their treatment months, or in the bovine situation, even years before they enter the food chain, versus use that's occurring much, much closer to the time of marketing. And I think that's one of the questions that is important for us to talk through and understand. So some points to consider. This was a logistics exercise. Can we get it? I think the data are interesting. They're interesting to participants. We have more systems participating now for the 18, 19, and 20 data. We're looking at gathering sow data because some of the systems they have the sow data. They're interested also in us analysing that because they also received the participants received much more detailed data about what their use looked like compared to everyone else's, even though the other participants were kept anonymous, so that the participants certainly through us did not know who the other participants were, but we gave them a comparison of where they sat in relation to what we would call their production peers. The question I raised before, does time of treatment matter in terms of public health implications? Metrics, I think we can spend a whole session on that, and I won't get into the details now, but I think in terms of discussion, we've used weight because it's simple for this exercise, but as Randy mentioned, it's a problematic metric, as are most of the others. Some of the European systems that use defined daily doses, they have real problems in application too, some of which we've illustrated in the publication. And we're still left with the question is do we have any metric that we consider to be biologically informative, and meaning that we can say it's demonstrably related to the emergence of resistance that may be of animal health or biological concern. And the point I raised much earlier that I think is a discussion point is the value of having more detailed industry-specific measures versus what I'll call looking for a compromise measure for what I'll call spurious harmonization, meaning the example there, what's the point of us trying to find a consensus metric that we could apply across species and geographies that doesn't actually reflect the conditions of use in some cases, any particular stakeholder group. Last thing, I think, just to bring up this issue is what's appropriate. It's as Randy said, we're doing the accounting exercise here. We're describing what we've got, but what we don't have insight into is what were the circumstances, what is appropriate use versus inappropriate. I think we all want to work at reducing inappropriate use in the industries versus some just a nominal number. This just came out yesterday, and this is a survey looking at COVID hospitalization cases, and it said 52% of COVID admissions had at least one antibiotic prescription, 36% had multiple antibiotics, and this was in, I think, about 5,000 hospitalized patients. They reported only 20% had bacterial pneumonia and 9% had urinary tract infections. 96% of patients with antimicrobial treatment were treated within 48 hours before confirmation of bacterial infection. And the conclusion of this study is that the findings strongly suggest that overprescribing of antibiotics occurred during the 6 months of the pandemic. And, you know, we've all lived through this. Many of us have known people and possibly lost people. And we know the strain that's been on our healthcare systems with people managing these critically ill people. And I'm not using this I'm just saying that context is really important. And if you put yourself in the boots of the people in these emergency rooms trying to keep people alive, you can understand they might take decisions that someone detached looking at the data months later might say, we think this is inappropriate behavior. And I just raise it because I think it's a really difficult issue. And my just closing philosophy here that I've been aware of for a long time is idealism increases in direct proportion to one's instance from the problem. And certainly my time in in veterinary practice is now a long time ago, but many times you didn't get called out where things were going well. You got called out when you were dealing with urgent situations. I was more in the fire brigade generation of veterinary science more than the preventive medicine one. But we've got to remember that people making these decisions are sometimes under considerable pressure. I think in what we're seeing with certainly in veterinarians in companies is a lot more ability to evaluate and look at their protocols and their approaches and trying to move forward and make their approaches to antimicrobial use increasingly prudent and based on good judgment. So I'll hand back to you, JJ, now.
All right, thank you, Peter. Mike Appley here. I will finish up here talking about antimicrobial use monitoring in U.S. feed yards. I'm trying to get my deal under control. There we go. I want to mention that our dairy aspect of our group's work is not presented here today, and that's not at all in any kind of intended slight towards that work. Dr. Schrog and Dr. Godden put together 3 great papers, and you'll see Dr. Moore put there in the chat the site to access these papers. The dairy project included 29 U.S. dairies widely dispersed across the country. There's 3 papers in that series, one of which is our actual data. The other is a comparison of metrics and how different metrics would give us a different impression of the relationship between dairies. And there's also a really good paper in there on just defining a regimen and how we defined a regimen. And you're going to see that we use 2 numerators, both regimens and weight, and looked at how they might show things differently. To reiterate what Peter said about his is that this is not a statistical sample of the U.S. feed yard industry, and nor is the dairy papers, and are they intended to be a statistical sample or representative of the entire industry. Rather, these are projects to go out into the industries, look to see how we might find the data, how we might capture them, quality assurance, quality control parameters that need to be instituted, and challenges to us. So again, not a statistical sample. And what we're showing you for the feed yard today is a summary report intended for public release. Individual participants each got a detailed report showing their use put in light of others, where they ranked and how they compared. And we did that, for example, by in-weight categories. We had 3 in-weight categories because in-weight and time on feed has a dramatic effect on both time of exposure, and in the case of in-weight, the lighter the animal, the higher the risk for respiratory disease, typically across the industry. So this is the paper we'll be talking about today. Dr. Katie Hope was the graduate student involved with this. And in our samples, we represented just under 600,000 head. There in 2016 and 2017, we had 667,000 plus head. Those represented about 2.5 and 2.6% of the annual steer and heifer slaughter reported by the USDA for each one of those years. So a small sample of the industry. Feed yards classified by total head. You see we had some closing out 2,500 head or less, all the way up to one closing out more than 100,000 head per year. So there was a large breadth of size involved in this study. We also represented feed yards from Nebraska, Iowa, Kansas, Colorado, and Texas. I very much appreciate their participation in the study. The record systems are quite interesting, and Peter did a nice job of, again, just explaining in the dairy system, or excuse me, the swine system, that the type of data they were capturing and using. In our case, in the feed yards, we had everything from very detailed individual animal ID, individual animal data, which was present for the vast majority of yards, all the way up to one of the very smallest yards in which we basically captured purchase records and knew the amount of animals that moved through, the treatment protocols, estimated average weight at the time of treatment, and were therefore able to estimate, how many regimens were administered, et cetera. Data interoperability is a key challenge across both human and animal health. And if you look back at the most recent report of the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria, you'll see that data interoperability is addressed in there. And we found that even within the same electronic record system, such as electronic system number 1, where 10 of our 22 feed yards had that in this case, we found that there was still quite a little bit to do in adjusting for different drug codes and different treatment codes. And it wasn't insurmountable, but it just takes time. Dr. Schrag on the dairy side had extensive work to do in working through and taking those codes, and for the ones that are in one system, they had 8 letters, 8 characters to record those. So those were correlated with treatment protocols, interviews, other records, et cetera, to come up with the regimens and the milligrams. So we did a lot of work in bringing these together into one uniform, quality controlled format in order to merge the data and come up with overall estimates. So we looked at both regimens and we looked at weight as milligrams for our numerators. And we'll talk about denominators here when we get to the next slides. But for the numerators and regimens, we captured regimens. So our regimen could be one administration of a single injection antimicrobial for a treatment of an acute bovine respiratory disease episode, or it could be 200 daily administrations of Tylosin for reduction in the incidence of liver abscesses. So that was one regimen. Those regimens in the paper are described by the duration in days and the milligrams per regimen. So the reason we really focused on regimens is if you say I gave one regimen of a single injection antimicrobial, and you ask me how many days of exposure do I have? Well, I could come up with that. Some of it's fairly subjective. Some of them are much more well characterized than others, but still there's a lot of subjectivity in that. Feed, number of days administered daily, a little more straightforward. But we did not feel we were qualified to come up for a lot of our single injection antimicrobials with a definite duration of exposure or days of therapy, and definitely weren't able to do that for an impact on resistance. And the reason we're here today talking about this is because of concerns about antimicrobial resistance. So understanding that people may want to interpret these as to what does this mean for exposure for the potential to select for resistance, we felt in our group that we'd be very misleading in trying to assign days of exposure to so many of these products. So we went with describing them. What you can see here is that our in-feed use, any medically important antimicrobial here reported is used in the feed. And as an aside, we did capture non-medically important antimicrobials, and those are reported in the paper separately. But here, about 79% of our total regimens that we captured were administered in the feed. The highest one was the macrolide class, which was Tylosin, and that was 1.2 million out of our total count of about 2.03 million. You can see our control of BRD was 13%. Those are administered at processing. There's a few, as discussed in the paper, there's one class in there, the aminoglycoside, that was not administered injectably. That was captured at one feed yard that evidently had some issues where they were administering an oral aminoglycoside to some at processing, but that was our protocol to take anything administered to the group at the time of processing or classified as control of BRD and putting it in that class. And then our individual animal treatment regimens were 7.8%. This chart describes our milligrams per kilogram of live weight sold metric. We matched milligrams of drug as a numerator with kilograms of live weight sold as a denominator for one of our metrics. All the criticisms of the use of milligrams are well received and understood. We did report them here because that's been a standard around the world for reporting these drugs. And you can see a huge effect of the class and potency on these, and that can't be ignored. The way this is set up is if you look at the original chart there, you see very, very low amounts for treatment for control of BRD and individual animal treatment. You can see very high bars there in the middle representing the higher proportional use in the feed. And then the insets let our y-axis fly, so you can actually see the differences between the small drugs, smaller amounts used for control of BRD and in treatment of individual animal disease. As mentioned by Peter, our cephalosporin, third generation cephalosporin, and our fluoroquinolone use are very minor parts of even these uses. And when looked at overall, they're very, very small as a percentage for those two classes. If you look at a percent of total for that year by milligrams per kilogram of live weight sold, you can see that for 2016, 47% was the green bar, which is the macrolides or Tylosin, and 48% was a tetracycline administered in the feed, which was all chlortetracycline, almost all of it, 10 milligrams per pound of body weight per day for up to 5 days. We did have one feed yard that was using 350 milligrams per head per day for a longer period upon arrival. And so that those were both put in there together, so had an effect on our reported durations of the regimen. That green bar is Tylosin, and the purple bar is our bar for the tetracycline class, which is chlortetracycline. You can see that in 2017, we moved to the macrolide use being 63% and the tetracycline use being 30% of total overall milligrams per kilogram of live weight sold. The macrolides went up because the chlortetracyclines went down, and I think most of the people on this webinar will understand that January 1, 2017, the new labels for in-feed medically important antimicrobials went into effect. And this, as demonstrated in national sales data, correlated with, not saying it's all cause and effect, but that subsequent year after that happened, we saw a dramatic drop in the number of milligrams used. Now, I want you to focus a minute on those bars and the percents. So this is milligrams per kilogram of live weight sold. So we're talking about milligrams of drug. So you'll see in 2016, they were essentially the same, very close. And if you look at 2017, they dropped to where the tetracyclines were approximately half of the macrolides. Now we're going to switch to the next metric we use, and that is regimens per animal year. So a regimen is, as we described, that is an animal gets a course of therapy. And for the macrolides, that can be 200 plus days if they're a calf fed. For the tetracyclines, the vast, vast majority of them were up to 5 days. So remember in our 2016 in-feed bars on the previous one of milligrams per kilogram live weight, they were essentially equal. Look here now, for 2016, when we look at regimens per animal year, we see that the tetracyclines are half of the macrolides. And then when we see that same reduction in 2017, they don't go down to half, they go down to a fourth of the macrolide use. And the reason for that is this simple example. If we administer macrolides for 200 days, Tylosin for 200 days at 90 milligrams per head per day, we've administered 18 grams of drug total. If we administer 10 milligrams per pound of body weight per day for 5 days to 500-pound calves, they just received 25 grams. 25 grams in 5 days versus 18 grams over 200 days. The milligrams and regimens can give you a dramatically different picture. So the feedlot paper goes into the two metrics, regimens per animal year and milligrams per kilogram live weight sold. So you can see 55, 25, 65, and 14. So whereas for 2016, they were essentially equal, when you go to regimens, now tetracyclines are half of the macrolide use. Another thing I wanted to cover briefly before we turn to questions is we also had the opportunity to administer surveys to 18 of our participants prior to them ever seeing their data. And granted, many of these participants routinely monitored their data from multiple angles, but this allowed us to actually compare what was going on. So now this chart looks very much the same, but please focus on the difference. Down there at the bottom, that's now record versus survey as opposed to year. So you can see that in the record, here in the middle, look at the green bar on the left, that's the record estimate of macrolide use in the feed, and on the right, that is the survey estimate. Overall, pretty close. If we go to this one, we now see we're back to our regimens. You see that these are, the first one was milligrams per kilogram live weight. Now regimens per animal year, just dang near dead on the tetracyclines, and they overestimated the number of regimens for the macrolides in here. But actually pretty close. I term the survey results as like going duck hunting with a statistician. You shoot in front of the first duck, you shoot in back of the second duck, and on average, you got 2 ducks, but the soup's pretty thin. And that's what happens with these data, is that when you look at the overall mean of survey versus actual data, pretty close. When you start to look at individual feed yards, there can be issues. So this is looking at ranking for milligrams per kilogram live weight. On the left is a heat map where the 18, there at the top under record, is the highest use, milligrams per kilogram live weight overall, and the bottom is down in the blue at number 1. They kept the same number as for the record when moved to the right under survey, and the same color. So you can see that 16, 17, 18 are still grouped at the top, and 1 and 2 are still grouped at the bottom, but it gets really mixed up in there. The 6th one by record is now the 1, 2, 3, 4, 5th highest by survey. The one that was 15th by record is now in the middle, so it mixes it up. So what happens if we rank by survey for regimens per animal year? And you can see that it really mixes them up. The bottom 5 are consistent between the 2, but now we have our 11th one by records up as 1st by survey, 9th by record is 2nd by survey, and things get mixed up pretty good. So just a nice illustration that we have to be very careful about how we interpret survey results. They give a great mean estimate, it appears from our data, but you can see quite a little bit of variations to any ranking. So that's a very quick run through of some of our key findings and points. I invite you to read all of these papers. Everyone's done a great job of including a lot of the nuances and things that were done, and I'm sure I speak for all the authors that we would be happy to answer questions, respond to comments from anyone. So thank you very much.
Thank you, Dr. Apley, and thanks to Dr. Bright, Dr. Singer, Dr. Davies as well for sharing their information with us today. We're going to run through a few questions. We have some questions already presented on the chat feature here. I think there's one, the references for the feedlot papers, they are included in that link that is in the presented earlier, correct, Dr. Apley?
Yes, that takes you to one site. You can scroll down and access all the papers. So I'd encourage everyone to scroll up in the chat and grab that reference for that site. And on that site, it is free to download any of these papers.
Actually put that back in there to everyone again so they can have it on that. For Dr. Davies, we had a question regarding how do you foresee guidance for industry 263 impacting the relative proportions of injectable antibiotic usage by class in swine, if at all?
Yeah, well, I think as in the swine data, again, the data we have is very much biased to large producers that already have well-established veterinary client-patient relationships. In fact, in most of the systems, the veterinarian was a salaried employee. So I think in that situation, it will have no impact. I think, and again, just to explain a little bit, the guidance would be bringing the outstanding over-the-counter products under veterinary supervision. So as with the previous, the guidance, I'm going to get there, 213, 217, which brought over-the-counter products in water under prescription, and all products in feed medically important under veterinary oversight. They are likely to have a much bigger impact on producers who do not have regular veterinary oversight or established relationships with veterinarians. So in this case, the producers who've been able to access those products without veterinary oversight are going to be impacted. I think as a proportion of the swine industry, that will be very small. So I don't expect that it would have a whole lot of impact at a broader industry level, but it will have a substantial impact on individual producers who, for reasons of location or something else, do not have established relationships with veterinarians. But Mike could probably be able to answer that question better than me.
Dr. Apley, we roll over to the beef industry with that same type of question. What do you feel the impact will be?
Well, for us, that would be long-acting oxytetracycline and procaine penicillin and procaine benzathine penicillin would probably be two of the biggest ones. There's also an injectable tylosin, some of the intermammaries, etc. It's going to, just like the new labels, the VFD labels, it's going to drive a lot of conversations between veterinarians and producers that may not have happened before. It will require that, obviously a veterinarian be involved in authorizing the use of those. And I think the conversations that ensued on the beef side with the VFD labels, I think a lot of good came from some of those, and maybe the same will happen here.
Great. Dr. Singer, Dr. Bright, anything to add to that particular topic?
I don't. The injectable is not a major component of poultry production.
Yeah, nothing from me either. Thank you.
So we have another question here. How do you envision data-driven decision-making could guide the need or its lack for use of antibiotics in feedlots and dairy sectors? And I think I'm going to pose this question to the whole group, and it almost sounds like you have the data now. What are the next steps? What do we do? Where do we go from here? And I'll start with Dr. Singer.
Trying to make sure I understand the question correctly. Data-driven decision-making.
I think I would put it maybe rephrase it a little bit, Dr. Singer, that we have the data now. And so how do we apply the data to make decisions within our antimicrobial use?
Right. Well, again, poultry represents, I would say, maybe it's a very different species commodity group than the others. With many, let's say, current broiler estimates are 60% of production is no antibiotics ever. There are no options for antimicrobial therapy if you're going to maintain that label. So already you're going to be limited in which antimicrobials you have available to you. There just aren't very many approved that are efficacious in poultry production, and that's one challenge that we do have. I think and we know what some of the standard diseases are in poultry production that necessitate therapy. So I don't know that there is a lot of necessarily new data that's going to change how we use antimicrobials. What's happening is you're trying to evaluate either the not medically important antimicrobials or alternatives to antimicrobials as effective treatment control strategies. But so I think this question may be better suited to both swine and then the cattle.
Yeah, I'll pick up on the swine side. I think that it won't influence a lot of decision making because we're looking at high level aggregate data. The people who are doing a really good job, and I've interacted with a lot of the veterinarians that are our participants, they already understand their own data. They already are looking at their own data. They're already reviewing, in some cases, evaluating their practices to try and optimize it. So they understand, you know, their own data are important for them, as is their disease diagnostic data. They're spending a lot of money on diagnostics. They're doing a lot of susceptibility testing and looking at improving their management. So what they're working on is disease control, understanding what they're doing, evaluating use so that they're, you know, not using antimicrobials that aren't giving them animal health benefits. I think that, you know, again, the more we go into higher level data, saying they're interested across the industry, they're interested in knowing what do my data look like versus other companies. Are we doing things differently? So I think there is value in I think if we move towards a viable benchmarking system, even at a descriptive level for people to just compare and contrast, that will be informative to them, but it's not going to inform their prescribing decisions in the way that their diagnostic data, their own practices. So you know, in the way that I've argued, the most valuable data is the most specific data. So pig industry data that's specific to the pig industry is worth a lot more than being able to compare it to pig producers in Europe or poultry producers in the US. Good quality enterprise level data so the veterinarians in the companies really have a good handle on what's going on. That's the way to move forward in I think a data-driven manner.
And I'll just jump in very similar vein to Peter in that everyone needs to understand these data were there. They didn't create the data for us. So these systems are practicing data-driven decision-making today. Some, the vast majority of them have incredibly complex and sophisticated data systems. We monitor disease, we monitor the drugs used for those diseases. We use evidence-based criteria to make decisions on which drugs to use. We look at clinical trials, et cetera. The one thing that is of interest, I think, benchmarking probably rather than antimicrobial use, some of the biggest interest in the benchmarking we run into is disease occurrence, and the drivers for the antimicrobial use is much or more as the antibiotics themselves. And I also see the question from Dr. Van Donkersgoed there. If you, and for the feed yards, if you included the ionophores there, we reported them completely separate, but their milligram use would be, it would cause the others to be about half the use because they're a higher milligram use. Their regimens would be, you know, an animal gets one regimen. So it's all detailed there in the feedlot paper, but it would cause the others to look a lower percentage, but obviously not change the amounts.
Yeah, Mike, I just add to that too. In my conversations with the swine veterinarians, the one thing that comes up all the time is wanting to look at mortality data, you know, not looking at antimicrobial use data in isolation, but understanding that, you know, they know the situations where you've got a lot of disease, you've got a lot of use, and having that context again is really important to getting any value out of this type of data.
Couple follow-up questions. If we paraphrase the two questions we have in the chat, both seem to head back to how is this data used to evaluate our guidance for industries effects that they've had. And so Dr. Bright, Dr. Apley, Dr. Singer, Dr. Davies, one goes down the path of duration of use. And was there anything out of the data that we could draw to evaluate that and establish that? And then Dr. Bright, this one might be for the overall picture about impact of these guidances and when we do these measures of antimicrobial use, are we making correlations with their impact on animal health, productivity, and animal welfare metrics, or even food pathogens, all those things that we these guidances in place for. So I threw a lot there. Maybe start with Dr. Apley. Anything you can draw out of your research on duration of use in the beef side, or would that be inappropriate from this data set?
From this data set, we capture and report the durations of the regimens. So that is in there, but as far as guiding decision-making on what the appropriate durations are, our data wouldn't be appropriate for that. I can tell you that there's a lot of work being done on that internally in systems. There's currently, the FDA has funded a study on that, 2 studies, I believe, actually on that through their recent grants program. So there's work being done on that.
Great. Dr. Bright, any comment on how FDA is looking at data to see the effect of their guidance for industry and how that would fit on the different parameters listed, such as animal welfare, use, food safety, along those lines? That's a broad question, I know.
Right. So it is a broad question, and we do think that a broad set of data is indicated to try to help answer those questions. So what we've been talking about today is one part of that. So the antimicrobial use part, at least the beginning of that part. And then obviously we do collect information through the NARMS program and some other antimicrobial resistance data collection points across various systems. And then I guess at this point in time, we are actually working on a what we're calling just kind of a comprehensive report, which is trying to kind of pull various data points together into one report to kind of look at the time frame, 2016, 17, and 18, that kind of straddles when those policy changes were made. It's going to be more or less a descriptive report of, sales, use, resistance of, and we do have some information in there regarding resistance in foodborne pathogens that the NARMS program monitors, as well as some animal pathogens. So that's, I'm not sure exactly when it's going to be published yet, but it's in process. We're hoping potentially later this year. And then, kind of, again, that's just an attempt to try to bring everything together and analyze it together, but also recognizing that the changes in sales or use, there might need to be some time that passes before we might see corresponding changes in resistance. So there's still a lot of kind of unknowns there, but we are attempting to put together more or less a descriptive report of those types of things that were mentioned here for these first 3 years or so after the policy change.
Yeah, I think it's important to point out just how hard it is to measure some of these things, particularly at the foodborne pathogen level, where, again, depending whether you're trying to measure on farm, at slaughter, in retail, all those in the human population, where do you really think you're going to see impact? If we go to the Dutch experience, they reduced on the pig side their antimicrobial use more than 50%. And this has been several years ago now, and the publications that have come out, the only one I've seen that they've reported something like a 20% reduction in resistant E. coli. And again, the definition being the proportion of E. coli that are resistant to any antimicrobial. I asked a Dutch scientist who was presenting some of that work several years ago about how they felt. You know, I said, you've done the perfect experiment. You've reduced your use by 50%. When do you think you'll be able to measure an impact at the human health or resistance level? And they said, well, maybe we'll have something in 5 years. I've asked a similar question to a Danish scientist because they've been doing a lot on use and reduction for almost 20 years now. And the answer was, we believe we're doing the right thing. Meaning, because in the Danish situation, it was driven very much by resistance in salmonella. And with the changes they made in the industry from their own dam map monitoring, resistance actually is increased after those interventions in salmonella, not decreased. And that's not necessary to say the programs weren't a good idea and they didn't achieve some good outcomes, but I think it's naive in some areas to think we'll make an intervention at this level and we'll be able to easily measure something in resistant salmonella in the food chain. They're very complex systems. There's a lot of noise, and we still don't really understand how big a reduction we need in use to get any sort of measurable effect on resistance. So good to hope for, but others may wish to comment. That's my preaching from the soapbox.
Thanks for the comments, Dr. Davies. It is a very complex issue, as we in NIA have been involved with a discussion over it for the past 10 years, and sometimes feel we haven't moved the needle at all in the discussion, because the more we know, the more we don't know. But any other comments from the panel? We are about 5 minutes over time, and we have a few more things just to bring to the. I would like to thank you for sharing this first step in a long journey, as Dr. Davies explained, in unraveling this complex issue. I would offer a chance for Dr. Wright, Dr. Singer, Dr. Apley for any other closing comments, or Dr. Davies before we wrap this up, and apologize for the questions we did not get to. If you want to email us, we'll gladly pass those on to the speakers for their consideration. So, Dr. Singer, Dr. Apley, Dr. Bright, anything else to add?
Well, this is Mike. I'd just thank everyone for attending, and just to point out that, you know, there's a lot of great conversation here. One of the things to do when considering antimicrobial use monitoring is to have a real clear goal in mind of why you would be doing it. And I think that's probably one of the most important things to look at if you're going to take off in that or try to evaluate or collect data.
Thank you, Dr. Apley. There's no other comments from a panel. Well, thank you again. I would like to remind you of our upcoming events for National Institute for Animal Agriculture. Our annual symposium, Exploring Sustainability in Animal Agriculture, is going to be virtual in April 21st to the 23rd. We'll continue this discussion and hopefully have more information to present about it in the 11th annual NIAA Antibiotics Symposium in Kansas City, November 2nd to the 4th. This webinar recording will be available to NIAA members and also available to registered guests at www.animalagriculture.org. So if you are not a member of NIAA, please reach out to Cassie or JJ and explore the opportunity to join. With that, again, I want to thank our panelists, thank our participants, and wish you all a great day. And thanks for joining us today.
Thank you.
Thanks, Eric.
Thank you.